Hi everyone, I'm Ranjani Kulawardhana from Jackson State University. I have my co-authors Alexi Pfister, Ajit Jayasekara, Jamiko Deleveaux, Shinjita Ghosh, Clifton Addison, and Paul Tchounwou. This work is based on preliminary analysis of my pilot project for developing a geospatial modeling framework to uncover potential determinants of COVID-19 health disparities. But in this presentation, I have our findings from first steps to map and characterize COVID-19 hotspot counties within the state of Mississippi. Our goal is to map and characterize spatial patterns in COVID-19 incidences, mortality, and their spatial determinants. We have two specific objectives. First, to map and quantify spatial patterns in COVID-19 incidences and mortality, and then to evaluate significance of sociodemographic and economic indicators as potential determinants of COVID-19 health disparity outcomes. Our study area, we focus on the state of Mississippi. We use data for all 82 counties. But the plan is to develop and apply the same approach for detailed analysis at municipality and zip code level. Our detailed analysis will initially focus on tri-county area of central Mississippi, Hinds, Madison, and Rankin. We have a three-step spatial analysis framework. First two steps are to map and characterize spatial patterns in data. In our step 3, we will develop regression models to develop regression relationships between COVID-19 variables and sociodemographic and economic variables. This is to evaluate sociodemographic and economic indicators as determinants of COVID-19 health disparities. Our objective 2. Data, we use county level data to derive COVID-19 variables and also sociodemographic and economic variables. As COVID-19 variables, we use cumulative cases and deaths as of December 15 of 2020, that is prior to vaccination. Here we have our county level spatial maps for COVID-19 variables. We can clearly see clustering of counties with high and low values for all COVID-19 variables, cumulative number of cases, cumulative number of deaths, and also when we look at percentage or proportion of cases from Black African Americans, and also the deaths from Black or African Americans. We got similar findings when we analyzed these data for hotspot and to detect hotspot counties. We found clear clustering of counties for COVID-19 incidences and also for mortality. Here we have a statistically significant cluster of high COVID-19 incidences and a similar cluster for high COVID-19 deaths from African Americans. What this really means is this clustering of counties for high COVID-19 incidences and also for high COVID-19 mortality in Black African Americans is not just the random chance. So we took one step forward to see what is really going on in these clusters. And when we analyze our data for each of these clusters separately, we have 3 clusters, non-significant, low-low cluster, and high-high cluster. What we notice, these counties within the high-high cluster are clearly different from the other areas in terms of COVID-19 incidences, mortality, and also socio-demographic and economic aspects. To give you a brief overview of these counties, in these counties within this high cluster, we found relatively higher percentage of cases and also deaths from Black African Americans. These counties are also characterized by low populations and population densities, low academic achievements, high unemployment, and also lower median income. So our next step is to develop regression models. When we have the regression models, we should be able to give very clear and concrete understanding about the potential determinants of COVID-19 health disparities. We are also planning to develop same approach at detailed analysis, but the COVID-19 data, we are still working with the Mississippi Health Department to access this COVID-19 data. Hopefully we'll be able to get them. I want to acknowledge the funding from NIH, NIMHD grant, and also our collaborators and Jackson State University for all the support for conducting this work. Thank you, everyone.